Zechariah is our little guy on the vent. His pregnancy started very normal.
20-week anatomy scan, they started seeing something was wrong with his heart, his kidneys.
They thought that he might have had Downs, just because some of his physical markers are similar to Downs. They had warned us going in, because we don't know exactly what the issue with his heart is and all the other issues going on, he might not make it even past birth. And so we kind of went into the delivery room thinking we're just gonna get to hold him and then he might pass. But instead, he was very stable for all his conditions. The Cook doctors, they came, they intubated him, and they just took him immediately to Cook.
What we learned about his condition post-birth was that he had a chromosome abnormality that is incredibly rare.
He has a distal 1q trisomy.
In his first chromosome, there are 2 parts that have duplications, and that causes things like heart issues, lungs, kidneys, potential scoliosis, seizures.
There's only 40 to 50 recorded medical cases of it, and even then, none have his exact duplication. That's been, on one hand, awesome, because we just get to see what he does, and on the other hand, we don't really have a lot of information to go off of. We got tied into the health plan right away. The social worker came in, she gave us, hey, these are kind of the plans that people go with. Given these different options, it just made sense to us, hey, they're local, they've done so much for Zechariah up to this point to go with the health plan. In trying to list all the different people that we see with the Cook Children's Health Plan, he has cardiology, pulmonology, endocrinology, 2 different
Nephrology,
neurosurgeon, ophthalmology,
audiologist,
urology, 4 or 5 different dietitians,
physical therapy, occupational therapy, speech therapy, feeding therapy,
cardiosurgeon, plastic surgeon for his hands, the Nest Clinic, geneticist, wound care, complex care, pediatrician. We have home health. Our health plan coordinator, we talk to her often. With being local, she can say, hey, these are some of my other patients, and let's say this is some of the other providers that they like, or these are some of the home health nurses that they've gone with, or these are some of the therapies that they've gone with.
She asks personal questions, and she even asks how I'm doing. She cares about my son's well-being, my well-being, that she says, if I need to jump in and make these appointments for you, make these phone calls for you, make sure you get this equipment faster. She truly cares for our family. That has just meant so much to me. His doctors, they have, from the very beginning, given us a lot of hope in his future, and that encourages me so much, and they're not willing to give up on him. Zechariah's therapists and nurses have been a tremendous blessing on my life as a mom, and them coming in and loving him and helping him to grow and hit milestones that I cannot help him hit has meant a lot to me.
Our hope is that he just continues to grow.
Maybe one day he can walk and talk to us, learn to communicate.
He's genuinely really joyful, and Cook has played a really big part in that. The health plan has been a tremendous help to Zechariah, and so having to switch would be a huge upset to our lives. Best case is we get to keep the same providers, the same home health, the same nurses, but we have to go through all that authorization process again. Even in the best of worlds, there's going to be a gap in his care. Worst case scenario, if we lost the health plan, we have to get completely new doctors, completely new home health.
Who don't know him, don't know his background, don't know anything about his progress.
Having to learn all new therapists, all new doctors would be an extremely stressful thing for him. Everything's going to be thrown to a much larger company. They're going to have much less personalized time for us. And so it would change everything. There doesn't seem a very good reason to switch not just our health plan, but also, hundreds of thousands of other kids and make a huge upset to this community. It just doesn't make sense to us. The Cook Health Plan is doing a fantastic job, so why change?